Michael and Dwyan.
Yes, good morning. I'm Michael Rhein with the Institute for Public Health Innovation, the president and CEO, and Dwyan and I are going to share our time, and I'd like to take less of it because Dwyan has really been a leader nationally and in our region, and I want to give her the time she needs. But as the Public Health Institute that serves D.C., Maryland, and Virginia, we have a broad mission and a lot of opportunities for, to foster multi-sector partnerships, to lead innovative solutions to public health issues in our region, and working at a systems level around workforce development, advocacy, capacity building, convening, leading the development of effective interventions. But we saw early on in our development, we're just 10 years old, that the community health workforce, while not the only solution and not a panacea, I think Shreya really gave us some cautionary points to that degree. But we just saw a tremendous opportunity to, and as Brian pointed out, what does it mean to practice health equity? We saw community health, community health worker workforce as an integral part of the practice of health equity. And so we got behind and we were all in. And in our role as a public health institute, we have the opportunity to get involved in workforce development. So we've trained over 600 community health workers in the last decade in our region, and helping to lead statewide conversations around scope of practice certification, to help to bring resources to bear on demonstration projects and pilots, and to do the kind of evaluation that was referenced, to help organize community health workers. We've been involved in developing the community health worker associations in Virginia, Maryland, and DC, and to find opportunities. Community health workers need institutional partners like public health institutes and others to make sure that they have a space at all the tables where the decisions are being made about their profession. So we've really taken on the responsibility to be the advocate, the institution that is behind the scenes and really ensuring that this workforce thrives, develops, that we have the information we need for it to be successful, they have the support they need, and that we're true to what those roles really are, and that we don't ask too much of community health workers. And we've seen, not just because of IPHI, many partners have been involved in this in our region, but we've seen a lot of great developments. All three jurisdictions have worked collaboratively with community health workers at the table. Over 50% of those at all these tables have been community health workers in our region. They've defined scope of practice, core competencies, training requirements. We've been working on certification in all three jurisdictions. We've seen more and more institutions creating employment opportunities and integrating those opportunities into the business model of the hospital, of the Medicaid managed care organization, of the health department. So we've been thrilled to see that. There's been a real involvement of community health workers as advocacy voices and leaders. Shantini and Kevin we know well, and we made sure that they were at this table living up to the responsibility that I described before. So we're thrilled with the progress that we've seen in our region, but there's a lot of work to be done still. I think the awareness and the understanding, while there is growing understanding of the role of community health workers, I think it's underappreciated and falsely understood and circumscribed, as Kevin mentioned. And so we really need to continue to work to lift up the critical role that community health workers play, and have them truly integrated into the teams that they're a part of. We also see this ongoing tension between the community rootedness of the role of community health workers and the professionalization and the certification movement. And at IPHI, we believe you can have both. We believe in certification. We advocate for voluntary certification. We believe that the community health worker title and role is owned by the community and comes from the community. The professional kind of certified community health worker role has a purpose within the healthcare system, but there are many community health workers that don't need to be certified and that have different kinds of training needs. So we really advocate for voluntary certification that respects that community history within the community health worker role, that quote unquote lay history, which we don't like that term. We also see a need for more sustainable financing of the role, and that can take the form ensuring that community health workers are worked into value-based contracts and Medicaid managed care approaches to funding good health outcomes, but also that healthcare providers, health departments, and other employers of community health workers see it as part of their business model to employ community health workers and just see the return on investment that can be had. So I'm going to stop there and turn it over to Dwyan.
Good afternoon, or good morning, I should say. My name is Dwyan Monroe. I am a program coordinator with the Institute for Public Health Innovation. I am also the lead and master trainer for our institute. I am a former community health worker, believe it or not. I've had over 25 years experience and really appreciate the opportunity to have gone up the career ladder to be an advocate for CHW. So I call myself a CHW for community health workers. So I don't want to go through definitions and roles because that's already been talked about. Some takeaways I just wrote down that I want you guys to really listen to, that I talk about when I talk in front of health providers, CBOs, anyone who's bringing on the infrastructure of community health workers. I will address a little bit about training, but I also will address about understanding that role as we move to the future. And when we talk about training, the thing you really need to take away from what we're talking about today is understanding their lived experience is half of the experience that they bring. The training that we provide just takes that lived experience and puts it in a way that, for all intents and purposes, pleases the organizations that they work for and address certain diseases and issues, but also gives them an opportunity to become a part of the health profession workforce. And it gives people who normally don't have to worry about how am I going to pay for education, how am I going to get there, because we see a lot of employer-based financing for training, support, and infrastructure that's built in. We're looking at mechanisms of apprenticeships when we talk about bringing on community health workers to minimize the barrier of having to go to a community college, which community colleges have curriculums and training, but there is a cost. So when we talk about getting the best people to hire for the role of community health worker, we want to minimize the barriers to the CHWs that are really good, and the barriers could be paying for education. So looking at how organizations can really push to have the employer pay for the training. And utilizing that lived experience as a part of the training that we provide. For IPHI, we provide a 100-hour course that's based on a lot of what's been looked at around the country as core competencies, core skills. We also add in disease-specific courses, just a minimum of overview of all of the major chronic diseases, including mental health and trauma-informed care. One of the unique things for IPHI is because we are a public health institute who promotes, lives, and breathes health equity, the first 2 days we do a perspective transformation training that looks at discussing things like prejudice, race, and understanding how the role of the CHW, there's a fundamental notion of not just doing your job, but understanding the purpose and the reason for why you are, who you are, how you've been hired, and what's happening in your community. And we think that is a very key for them to understand that. The other thing I want to take away, and Michael already mentioned, and Shreya as well, thank you so much, is team integration. We have a difficult time. Organizations will send us CHWs in droves. We've trained about 546. But when we talk about training for supervisors and team and bringing the team together along with the CHW to sit down and figure out with them, what is the flow? How is this going to work? What patients will I address? How will the CHW adhere or at least provide that opportunity? We don't get a lot of uptake. And so what happens about 3 or 6 months down the line, we get a call from the organization, we're having issues with our CHW. But it's not really the issue with the CHW, it's the fact that we gave you a role that you have no clue what to do with. And we offered an opportunity with expertise from including the CHW to help figure out what to do, okay? So if you do nothing else, if you're an organization, please consider team integration, that full breadth of everyone understanding how to really value and incorporate this role. And the last thing is to understand that when we talk about associations and community networks, community health worker networks, there's about 45 now around the country. When I started as a CHW, there were about 12 or 13. So the advocacy and the groundswell is building. Community health workers have a voice. There's a national entity called Unity. It's a National Community Health Worker Conference. Workforce development, when we talk about that, is sending your community health workers to ongoing workforce development training, sending them to conferences and workshops like this, and anything that addresses, that supports the role of what they have is critical. When you have nurses and other health professionals, they get, and I know accreditation is an issue, so we're all working on how do we accredit that, how do we incentivize them going. But organizations really need to support that piece of making sure that CHWs are doing that and being a part of that whole workforce. Thank you.
Thank you.